Welcome back to Good Morning San Diego. Coronary artery disease or heart attacks, leading cause of death in the United States, but many people don't know they have the disease until they experience a heart attack. And now scientists from Scripps Research Transitional Institute have developed a way to help estimate a patient's risk. Dr. Ali Torkamani, a professor at Scripps Research, joins us now with the details. We were kind of joking, not medical doctor.
That's right, not that kind of doctor.
This is more research-based, what we're talking about, and it's using a model with prediction in there. Talk a little bit about the research behind this and what you're looking to predict.
Sure. Like you said, the first sign that most people are at risk for a heart attack is having a heart attack. So we're trying to come up with better risk prediction models to identify people that are at risk. Not only identify people at risk, but determine what interventions would help the best. And I'm a geneticist by training, so we incorporate genetic information into that model to make more accurate risk predictions and connect people with the right interventions.
So what are you typically looking at or looking for as a basis of this prediction model?
So the traditional models out there use your age, whether or not you have diabetes, cholesterol levels, blood pressure levels, are sort of the main components. We use that as well, but include the genetic risk underlying those components and add a few other things like depression, sleep status, etc. And we make predictions about all of those features about you, as well as the sort of the known measurements. So we predict what your LDL levels are and also measure your LDL levels. And it's the combination of those predictions plus the measured factors that go into another risk prediction model to ultimately predict whether or not you're going to have a heart attack in the next 10 years.
And I imagine you want this to be applied in more everyday life to help people better prepare, change their lifestyles. How do you see this model, this predicting factor, played out into the real everyday?
Yeah, so we do a decent job predicting right now who's at risk, but it doesn't give you a lot of information about what you should do about it. So one of the big problems is actually adherence to preventative interventions. You know, even adherence to exercise and diet interventions, that sort of thing, are problematic. So we sort of figured if we can not only make better predictions, but also predict what interventions would work better for individuals, that prediction would be a little bit more sticky, I suppose. And you know, when you're empowered with what to actually do with that information, then perhaps people would actually take on those preventative interventions and sort of stick to them.
Right. Is this something that you think will be widely used in the future, or you hope it to be widely used in the future, and how far out could that be?
I certainly hope it'll be used in the future. It's a little bit complex right now. It sort of requires ingestion of an entire medical record, not only that, but also genetic information. That information is out there, but I would say the systems to really allow you to routinely sort of ingest all that medical information and then spit out predictions within the time, you know, that you'd be visiting your doctor, for example. It's coming. We have that infrastructure, but it's sort of a little future looking.
Right. Well, I mean, for the longest time, it was environmental versus genetic, right?
Yes.
And you're saying we definitely need to take a look at a combination of both more in depth.
Absolutely. It's really you need to see the holistic picture, and when you have that holistic picture, then that informs you about what to do about it. Was
there any standout information of a red flag that was perhaps greater than the rest, maybe not anticipated?
I was actually pretty surprised that the model picked up genetic risk for depression and insomnia as important factors for risk prediction. I was sort of not surprised about the usual stuff, LDL, etc., but the fact that we didn't train the model to know, you know, that depression or sleep problems are an issue, but the fact that it sort of automatically picked them up, including the genetic risk factors for that, was pretty surprising to me.
Yeah. All right. Well, thank you so much. Appreciate the information, and maybe we can all use it to make better decisions.
Thank you.